Hey everybody, my name's Elisa. We're back. We're talking about the male reproductive system, and this time, oh, there goes. We are talking about part 12, the male sexual response. All right, it's actually relatively recently that we've been looking at the sexual response in like a clinical way. So some of it started off by William Masters and Virginia Johnson in 1966, so that was like relatively recent. And they started by just kind of baselining some things, like dividing out some things. So, excitement, plateau, orgasm, and resolution. And so, this is important because it leads to things like therapy for sexual dysfunction, and also the understanding that things like erections can be, they're not always elective. Signaling that there was like sexual stimulation as much as there was reflexive stimulation, right? And so, like, this is where male rape comes into um, the forum a little bit more. So it's just something to really be aware of and to have your hand on the pulse of the situation. And sexual dysfunction is incredibly difficult for people. Very, very emotional, very psychological, lots of reproductions. So sexual intercourse is also referred to as coitus, coition, copulation, lots of other terms, but we're not going to use them here. These are the ones on the test. Anatomical foundations. So, two penile artery enters the root of the penis and divides into two. And like this is going to be that blood flow. So it's really important that we have an erection followed by ejaculation of mature and healthy sperm in a proper sperm count in order for that to be um, a, a sexual response that is a fertile sexual response. And there's other ways around some of those issues, especially in modern medicine, if it is one, but generally. So the penile artery is going to it's huge and it's going to divide it into two. So there's a dorsal artery as well as like the deep artery. So the dorsal artery is like closer to the surface of the skin. And so there's going to be blood supply to the skin and, of course, all the connective tissue, the fascia. Corpus spongiosum and so most of the time, this is like going to be like the main workhorse of the penis, like right here. This is going to be the dorsal artery. It's just making sure everybody's got enough blood and everybody's okay. But the thing is the deep artery is going to be important for sexual function. And so this is going to be right through the core of the corpus cavernosa. If you remember, we have like here's corpus cavernosa, spongiosum, right? And these are those deep arteries that are going like right here and right here. That's going to allow for that super fast um, like dilation of the arteries, and so all of those like spaces in the cavernous corpus cavernosum are going to be able to fill with blood relatively quickly, and so then we have an erection that can um, become achieved at this point. Um, right, so like the deep dorsal vein is actually going to drain the blood from the penis as well. So there's a deep dorsal vein, but right, we're starting here. The penis is richly innervated, right? So penis clitoris are sexual stimulation doesn't require um, touch of specifically the copulatory organs of the penis or the clitoris, but it definitely is part of the process, evolutionarily speaking. The glands in the precipice have like a lot of these nerve endings, and like they are tons of these tactile um, nerve endings, and so they also respond to temperature as well. So the dorsal nerves of the penis and the internal nerves are going to lead to the sacrum of the spinal cord, right? Like here's the spinal cord, thoracic cavity, right? Imagine that's ribs, right? And then here's pelvis, and then sacrum is like that last little bit up here on the part of the sacrum. Both autonomic and somatic motor fibers are going to carry these impulses from the spine, and they integrate into a integrating center in the penis. So there can be nerve damage that can impact an individual's ability to maintain an erection, or to have in like what their sensory information is going to be processed like through the penis. So that's just important to keep in mind. Sympathetic nervous system is going to help induce the erection in response to input from special senses, right? Um, the nerves, or it's simply through thoughts as well. Um, Parasympathetic is going to induce erection from direct contact of like the glans precipice area of the penis. So there's one that's kind of external and then one that's also direct. Okay, excitement and plateau. Excitement phase is going to be when vasocongestion or the swelling of the genitals with blood. So this is the erection, myotonia, muscle tension as well, and an increase in heart rate, blood pressure, pulmonary ventilation. Bulbourethral glands are going to be secreting fluid, right, cleaning that urethra, getting ready for that final ejaculation, making everything just perfect for sperm. It can be initiated by lots of stuff, erotic stimuli, just anything mental, um, like touch. Erection is primarily due to parasympathetic triggering of nitric oxide secretion, right? So a teeny tiny molecule, big nervous system impact, dilation of those deep arteries, and the filling of the cavernous spaces with blood. Um, Further, and that's what creates the erection altogether. So we refer to this as vasocongestion. Can also cause the testes to increase as well. So they become a little puffier as well, up to about like 50% puffier. And so the erection allows for intromission or entry into the vagina and also really putting the head of the penis right up against the inside component of the, oh my gosh, cervix. I wanted to say clitoris. I'm so sorry, you guys. So up against the cervix, because the cervix is the entry point up into the uterus, which is, the fallopian tubes and all this stuff. So we really want to have like as much direct contact as possible, right? That also, the erection also allows for the ability of some of the abilities for female orgasm to occur, which is something we'll talk about a little bit later, and we'll tie that into reproduction altogether. But a plateau phase is different. So the plateau phase is respiratory rate, heart rate, blood pressure all stay pretty increased. Um, and there is still vasocongestion and myotonia, but it only lasts for a little bit before orgasm. Um, and so it's kind of like this is going to happen. Orgasm is happening. That's what the plateau is. All right. I'm trying to change the page. There it is. Okay, so neural control of male sexual. So you can come from thoughts. It can also be reflexive, or it can come from like specific sexual stimulation of the genital region, especially like the tip and the head, the glands of the penis, which is tons and tons of nerve endings there. So here we have an integration center. This is the spinal cord and the sacrum as well. So what that results in is what we refer to as excitement, or essentially either the reflex of the erection or like, the specific excitement from selective sexual stimulation or elective. Orgasm is referred to as the emission state because you're emitting semen, right? So that's what that is referring to. We're secreting all the seminal fluid. Why is my, there it is. Okay. The seminal fluid, you're secreting seminal fluid. Um, at the expulsion stage is when we actually finally have all of the components of semen pulled together. And now we're going to be able to use that bulbocavernous muscle, and that is going to contract rhythmically. And that is what's going to cause semen to ejaculate or to shoot out of the head of the penis at quite a velocity. It can go quite a distance as well. And so that tiny muscle is responsible for that ejaculation. So that is, yeah, there we go. And then resolution. So afterwards, their blood is reabsorbed back into the circulatory system. The penis is drained. It becomes flaccid again. The testicles, they start reducing also in size because of loss of blood. The body kind of starts resting after all of that excitement and busyness. And right. So that is known as a resolution because it is now resolved. Let me see if I can get this back to, there it is. So that's the neural control, right? So it's definitely like a handful of feedback loops. As you can see, sacral as well as spinal, lumbar. as well, all the way to sacral. Um, right, I think that's pretty good. That's generally what we need you to know. Orgasm ejaculation, also known as climax, is short-ish, but is shortened in males, but is an intense reaction that is usually marked by a discharge of semen. So this doesn't last a long time, 3 to even up to 15 seconds. Things like heart rate, blood pressure, and breathing, sweating, everything just really greatly elevate during this time. Also, I should probably point out that there are a lot of involuntary functions that occur at this time. Um, some of those include closing your eyes. Some of those include not being aware of your surroundings. So it's just something I should mention. Okay. All right. Ejaculation occurs in two stages: emission, expulsion. We were talking about this. So emission is the sympathetic nervous system is going to stimulate peristalsis, which is going to help propel that sperm through the ducts and collect all the secretions we need for semen. Expulsion is semen's all collected together, everyone's there, and now we are going to expel it through the urethra, um, and we are going to use specific muscles and sympathetic reflexes that are going to lead to that expulsion or ejaculation. Right. So something to point out too is the sympathetic reflex is actually going to constrict the internal urethral sphincter so that you can't have urine enter the urethra at the same time semen, because that would be disastrous for the semen. Disastrous. The other thing is you don't want semen to enter the urethra in the bladder as well. It's not necessarily super great if that were to happen. Ejaculation and orgasm are not exactly the same. They can occur together, but they can also happen separately. They typically are considered to happen together. Resolution phase, the body is kind of like winding down, recovery time. Sympathetic signals are going to constrict that artery on the inside of the cavernous tissue of the penis, and it's going to reduce that blood flow, allowing the veins to drain it, and the penis is going to rest and become soft and flaccid. Cardiovascular, respiratory functions, everything is going to kind of just downscale, return to normal, and we're going to have what we call a refractory period. So the refractory period is an important concept because it's following the resolution, and it's not possible. So it's not impossible for someone to have another erection, but most of the time it needs to cycle out. Like it's going to be a little bit of time before they can go back. It can be as small as 10 minutes, it can be a few hours. So it kind of just depends on that individual, their health, their age, a whole bunch of different factors. Okay. Yep, that's it. Okay, so that was it. And I hope that was super helpful. And I hope you're out there somewhere having a great day. Okay, goodbye.